Welcome to the NQI Reporting Center. This brief tutorial will show you how to download reports for school-based health centers and use the Alliance's resources to support your quality improvement efforts in your SBHCs. Whether you're an SBHC provider, administrator, or state-level representative, the reports that you can access through our NQI Reporting Center will be useful to you in viewing how an SBHC is performing, where you may be excelling, and where there are areas for improvement. This improvement lens is really important for the Alliance. We view these reports as a way to support the delivery of the highest quality of care in school-based health centers. We don't view these reports as evaluative. We hope that you will use them in your communities to view how school-based health centers are performing, set improvement targets, and deliver the highest quality of care to children and adolescents. So let's talk about the two main functions of the reporting center. You can compare one or more school-based health centers' data to state and national averages, and you can compare one or more school-based health centers' data from one year to the next. There are also two audiences. There are reports for individuals viewing data for one school-based health center. Those would be the providers and staff from one school-based health center who wants to view their individual health center's data. The second audience is sponsors or administrators and state-level representatives who can view reports for multiple school-based health centers in their state. Now I want to show you how the reporting system works. I'm going to demo the system using school-based health centers in North Carolina, sponsored by UNC Rockingham Healthcare. I've been given permission to show the reports for these school-based health centers. They're a great example because they've been working in collaboration with the Alliance through our National Quality Initiative quality improvement efforts over the past several years, and they've been working very hard and identifying promising strategies to deliver high-quality care in their SBHCs. So first I want to show you how to compare the data for one school-based health center with state and national averages. This report is available to staff working in this school-based health center and sponsor and state-level representatives in this state. SBHC staff from other SBHCs can only view the reports for their individual school-based health center. So I'm going to click here. First, I'll select North Carolina from the drop-down menu. Then I'll select UNC Rockingham Healthcare. And I'd like to view the data for Moorhead High School Student Health Center. I want to see the data for the 2017-2018 school year. I want to be able to compare data to state and national averages. And I want to view data for all 5 performance measures. As I scroll down, I can view a bar chart that shows how my school-based health center compares to state and national averages for each of the performance measures. My school-based health center is blue, state averages are navy blue, and national averages are brown. If I scroll down further, I can view tables that show how my school-based health center compares to state and national averages. I can view how many school-based health centers reported data for each measure. Green arrows show where my school-based health center is performing better than state or national averages. Yellow arrows show where my school-based health center is performing less than state or national averages. Scroll down further to view basic visit data, total number of clients, total number of visits, number of clients by gender, and number of clients by age, and view how my school-based health center's data compares to state and national averages. If you scroll back up, you can click on this button that says Save or Print to either save or download a printable version of this report. Now I want to show you how you can view how this school-based health center compares from 2016 to 2017-18. Again, I'm going to select North Carolina, UNC Rockingham Healthcare, and again, I'll select Moorhead High School Student Health Center. This school-based health center reported data for both the 2016-17 and 2017-18 school years. So I have the ability now to compare performance from one year to the next. I selected all 5 of the performance measures. I can scroll down to view a bar chart that shows the performance of this school-based health center from the 2016-17 school year to the 2017-18 school year. If I scroll down further, I can view tables that show the percent change in the measures for this school-based health center from this school year to the next. Green arrows again show where there have been improvements from one school year to the next. Yellow arrows show where there has not been improvement from one year to the next, and the equal sign shows where the performance is the same from one year to the next. Next, I want to show you how the reporting center can be used to compare data for multiple school-based health centers. I'm going to select North Carolina, UNC Rockingham Healthcare. And now I can select up to 10 school-based health centers to be included in the charts and the tables at one time. Note that only sites that have valid NQI data will be visible. To enter data for more sites, you can return to the data portal to add more data. I'm going to select all 4 school-based health centers. I want to compare school-based health centers to state and national averages for the 2017-18 school year. And I'm going to start by looking at the well-child visit. When viewing reports for multiple school-based health centers, you can only view measures one at a time. Scroll down to see a bar chart that shows how multiple school-based health centers compare to the state and national averages. Scroll down further to see how multiple school-based health centers compare with one another across basic client and visit data, as well as how they compare to state and national averages. Finally, I want to show you how you can compare multiple school-based health center data from one year to another. I'll pick North Carolina, UNC Rockingham Healthcare, and I want to see how all of these school-based health centers compare from the 2016-17 school year to the 2017-18 school year. Again, I can pick one measure, and I'm going to start with the well-child visit. Here in this bar chart, you can view multiple school-based health centers and how they compare for from the 2016-17 school year to the 2017-18 school year. Scroll down further, and again, you can view how each of the school-based health centers compares to one another and from one year to the next for this specific measure. So what else can you do with the reports? In this menu on the right, you can view an overview of the initiative. You can view measure definitions. And if you'd like to go in during the defined time period to report or edit your data, you can do so. Here you can view video tutorials like this one about how to use the system. You can review our data privacy and security policy, and you can view our clinical performance measures toolkit. This toolkit includes promising strategies, frequently asked questions, and other information about how you can deliver the highest quality of care in your school-based health center. Finally, you can ask us a question, and we encourage you to do so. We're here to help you and support you in using these reports to deliver the highest quality care in your school-based health centers. Thank you.